Hey, Jim Hoffman here from Turomedic, and today I want to continue on with this quick little video series about blood loss and hemorrhaging. And today I want to real quick just talk about the types of external bleeding. And the first one that a lot of us concern ourselves the most about is that arterial bleeding, right? That's usually bright red blood, it's spurting. A lot of times it can be timed with the patient's heartbeat. And again, it's the most serious and least likely to clot due to this high pressure, making us have to use things like tourniquets. The second type is venous bleeding. Now, this is darker in color. It may flow fast, it may flow slow, but it doesn't spurt. Now, it's less severe than the arterial bleeding, but it bleeds more than, let's say, a capillary type of a bleed. And that's our third type, the capillary bleeding. Now, this bleeding is good for us because it's the most likely to clot. It's dark red, it oozes, it doesn't really flow, but it can ooze steadily. But a lot of times when it's oozing steadily, it's kind of a slow rate that it's going at. So, what are the body's responses to this bleeding? Well, the initial response is when the skin gets cut. And that response is blood coming out, right? And then we have the vasoconstriction. And this is when the body starts to narrow the opening of the vessel in an attempt to reduce the blood flow. And then finally, you've got that clotting process, that coagulation. And this can be hindered by things like anticoagulants, patients that are on Coumadin, or maybe they take aspirin every day. And sometimes you might see the clotting process hindered because of a patient having a condition like hemophilia. So these are all the types of things to think about when we think about external bleeding and the body's response to that bleeding. Now we're going to go on to another video real quick and talk about how to manage bleeding. But in the meantime, if you want some more free study hacks, go check out Turomedic Insider. It is free. It's packed with lots of easy tips and resources that you can use to really help you crush your exams and your EMS goals. You can grab it all over at myturomedic.com. I'll put a link below in the notes for you. As always, I'm Jim Hoffman from Turomedic. Stay safe.